So welcome to the All Souls UU Forum. We're being recorded for both YouTube video and audio for rebroadcast on KKFI. This morning's speaker is Nomachot Adiang, who is an organizer with Missouri Healthcare for All, which is the group that led the very successful campaign to have voter approval for expansion of Medicaid in Missouri last year and survived a successful court challenge and is now, I believe, going into effect. So we often have large social issues to complain about here at the forum, as we have discussed this issue in the past, but this is particularly a day for us to celebrate a very significant victory. And Nomachot played a very significant role in this as well. So I've asked her to come and talk about how this happened, how it came to be, why it was successful, and what she sees as the challenges ahead in this campaign to get better health care for Missourians. So with that, I'll turn over to Nomachot, and who will talk for about 35, 40 minutes, and then we'll have a little break, and then we'll do a little question and answer for those participating. So Nomachot, welcome. Go right ahead.
Yes, hi everyone. My name is Nomachot, and I'm the Kansas City organizer for Missouri Healthcare for All. I guess I'll talk a little bit about myself before getting into the campaign. I did grow up in Kansas City. My family came here from South Sudan as refugees. So I've been here since I was about 4 years old. I think I kind of got into organizing accidentally. I didn't know that's something you get paid for. I went to school at Missouri State University to study sociology and global studies. And then through my volunteer work, I learned about organizing with the Jobs of Justice in Springfield. And then when I decided to move back to Kansas City at the end of 2018, they referred me to the Jobs of Justice here in Kansas City. And that's actually kind of how I started on the Medicaid expansion campaign. I first started as a volunteer because we started gathering signatures in August of 2019 for the campaign. And then in the middle of it, had gotten hired by Missouri Healthcare for All to continue the work with signature gathering. Okay, so today I'll be talking about Missouri Medicaid expansion and the role that Missouri Healthcare for All played in it. So Missouri Healthcare for All, the ultimate goal is to fight for access to quality, affordable healthcare for all Missourians. Our mission is, we are a statewide organization that is nonpartisan. We are faith and community-based grassroots movements. We're dedicated to principles that every Missourian deserves access to quality, affordable healthcare, no matter where they live and how much money they make, or their identity. So our work has been focusing on the pillars for a new American healthcare system. So it includes 6 components. 1 is an integrated system. 2, that everyone would have freedom to choose their provider. That there be no cost barriers to care, that it is economically prudent, that is comprehensive care, and then there's an emphasis on community and health equity. So those pillars are basically a visionary framework that we use to guide our work beyond Medicaid and other policies that we advocate for that kind of protect current policies that have been placed, like Medicaid, and for us to evaluate current and future proposals for a new healthcare system and policy document. It's more of a way for us to see, do these policies have those components, and if they do, then it's a closer step to universal health care. And so the pillars are the cornerstone of our organizing. So I'm going to talk about what it means to organize. So organizing is about collective action that people that are directly impacted challenge the status quo, demand changes in policy and practice, educate communities about root causes, and advocate and agitate for systemic and just solutions. So the focus of organizing is for those who are directly impacted to build the power and use that power to influence not only legislation, but eventually transform how we look at systems. We organize is to build power in essential in a way to affect change. We need impacted people to inform and guide our work and inform and guide policy, because a lot of times those who make those decisions are not those who are going to be the most affected by those policy changes. And we use it to grow our own base and increase the power to enact change throughout the state of Missouri, and then obviously throughout the whole of the United States. So before we talk about like the Medicaid expansion campaign, this is basically how Medicaid worked before expansion. So those who qualified were seniors, children up to about 300% of the poverty level, folks who were pregnant, but with that, you could only get support up to 60 days after you gave birth, which is problematic because maternal mortality is something that happens within the first 12 months of pregnancy. And so you're actually at risk of dying 12 months after you give birth. It also was something that folks with disabilities had access to, and then parents who made 22% of the poverty level. And so besides Texas, we had the most extreme guidelines for Medicaid. And Texas had 18% of the poverty level for those who could qualify. And then people who didn't were those who were that had no disabilities, didn't have any children, no matter how much money they made. And then parents who made more than 22% of the poverty level. So if 22% of the poverty level is basically $319 per month, or about $4,000 a year for a family of two. So most people make minimum wage, and even if you made minimum wage, you would not have qualified for any form of Medicaid, and that was the problem. So there was a lot of folks that were in the Medicaid gap. A lot of folks couldn't get insurance through their job. I think only about 54% of Missourians have health insurance through their job. A lot of people couldn't afford the health plans in the marketplace. There were subsidies, but not all of the folks could qualify, or the amount they would have to pay would be really high. And basically, folks would put off going to get healthcare needs met until it was too late, which also put a burden on our healthcare system, because we know going to an emergency room is much higher, and at that point too, whatever health condition you had would be at a worse state than it would have been if you were able to go for preventative care. I think an interesting example of how we can see this is that Missouri was ranked 44th for maternal mortality. And for Black mothers, even with the outcomes for mothers as a whole, Black mothers were 3 times as likely to die from birth. And the reason being because a lot of women did not receive any form of healthcare access until they got pregnant. And so there was no way to see any like conditions that they would have to watch beforehand or to prepare them for a healthier birth. Yeah, so it was a lot of people. It was about 250,000 who would have qualified for Medicaid expansion when it was available to us in at this point a decade ago, that had never had gotten it, which also directly impacted how many folks who might have even passed away because they never got the healthcare they needed. So a Medicaid expansion would increase the requirement to 138% of the poverty level. So for a family of two, that goes from $3,800 a year to $24,000 a year. And it also allowed childless adults to qualify. I myself did not have insurance. I was a benefactor of the Medicaid program. Since my mom came here, since we came here as refugees, we didn't really have much money. And so I was on Medicaid up until I was 19 years old. And as someone who received healthcare up until that point, it was something that was very helpful for my mother to be able to take us to the hospital and not have any issues. The only problem is that children don't actually put much of a burden on the healthcare system, since a lot of us, are less likely to have issues compared to older adults. And so after turning 19, I didn't have healthcare insurance until I was in AmeriCorps Vista, and then until I got this job. Let's see. And also it allows folks who are at minimum wage to be able to get access to healthcare without having to have had children. It also brings more money back into the state of Missouri, since now the state will get 90% of the costs paid to by the federal government. The other impact that not expanding Medicaid had was on rural hospitals. Even now, there have been a few hospitals that are vulnerable to closing. In the past 6 years, we've closed 15 rural hospitals, and that has increased the distance that folks have to go to access healthcare, which also means that there's a chance that if they're in an emergency situation, they may not be able to make it. It's all because of the fact that money was not going back into a lot of hospitals. Okay, so yeah, the benefits of Medicaid expansion was that it would save the Medicaid program more money over time. Before this, I think some of the costs of Medicaid, we would get a reimbursement of up to 60%, but now it's gonna be 90%. It would improve the economy and allow for more jobs to be developed because of more money coming into the hospital system. It would improve maternal and infant mortality rates. It would protect hospitals, especially rural hospitals, and it would decrease systemic inequities. So Missouri Healthcare for All actually worked with a coalition to gather signatures for Medicaid expansion. So we started the campaign in August of 2019, and from August 2019 to the beginning of 2020, Missouri Healthcare for All gathered 11,000 signatures. Oh my gosh. Give me a second. 11,811 signatures. But in the actual coalition, we gathered over 100,000 signatures. And one thing I think is important to note is that we were not originally going to be involved in the campaign. The only reason that us and other partners like Jobs with Justice, Planned Parenthood, were all able to be part of this campaign is because we demonstrated that we had the people power to do that work. And so when we gathered signatures, they were more likely to be qualified and to be accurate because we knew our volunteers and we trained them on how to do it compared to the paid canvassers for the larger campaign. And then within the 2 weeks leading up to the actual election, we worked in the same coalition, which is called MOVE, and completed 1,242 phone banks. We engaged 25,000 voters, and then sent out 120,000 texts and dialed 500,000 phone numbers. And so on August 2nd, we were able to celebrate, and 53% of folks voted yes on Amendment 2. And we had expected that people would be able to enroll in July 1st of 2021. And so this shows you, like, with the campaign, we were we gathered 350,000 signatures, and that's almost twice as much as you need to actually get something on the ballot. So we were expecting to have folks to be able to apply in July of 2021. So we spent most of legislative session trying to reach out to legislators to make sure that they would be able to fund Medicaid and put it in their versions of their budgets. And with meetings, we worked a lot with mobilizing folks to call their legislators, and even with all of that work, they decided not to fund Medicaid. And then the governor, who had originally stated that he would respect the will of the voters, and that he even included funding in his proposed budget, basically reversed he reversed his actions and then withdrew the state plan in May. And so that put us in a very stressful situation because we did not know what we were going to do about this. And so since at that point, it was not in the legislators' hands, it was in the governor's hand, we went to Jefferson City. First, we did a statewide rally regionally. And then we went to Jefferson City to rally against the governor and marched to his actual office to kind of pressure him. It was a very interesting experience because we met with so many faith leaders and folks from across the state in one area. And the governor was actually in that building. And we were kind of worried about, so like basically that was one of the tactics we used, but at the same time we were also working to the state for not expanding Medicaid. And so two of the storytellers that we worked with were part of the plaintiffs. There were three single mothers who filed a lawsuit against the state. And so basically saying that we had a constitutional right to it. At first, the Cole County judge ruled against the plaintiffs in June. And then in July, the Supreme Court overruled Beadham's decision. And they unanimously named up to the law of the land. And so, and then in August, Beadham mandates the state to begin enrolling those making 138% poverty level and above. And so actually, that was supposed to be something that was going to happen immediately, but DSS basically said that they didn't have the infrastructure to be able to do that. And so it took a couple months for them to be able to enroll adults. And now, on Friday, the Department of Social Services began processing applications. And also, because there was a promise to expand Medicaid in July of 2020, any services that an adult has used who qualifies for Medicaid since July is going to be reimbursed. And so we're going to expect 250,000 residents to be able to access Medicaid.
Yeah, let's take a little break. For those of you who are joining us, of course, we need to cover our costs and appreciate your contribution to cover the cost of presenting the forum. So we've got a little video. Richard, is that right?
All right, thanks for attending today. The All Souls Forum is very important to our church. It provides us a chance to discuss the significant issues that impact our community. It's also important to me personally because I get to learn about the political issues that shape our world and ask questions of our speakers. From the attempted coup on the Capitol to recycling, we discuss all of the important issues. It costs about $100 a week to produce the forum. That's less than $5 a week per person watching on an average week. Andrea, can you show us how to support the UU Forum?
I'd be happy to, Richard. You can always send a check to the church. Be sure to put forum in the memo line. You'll find the address in chat, or you can find it on our website. To pay online, you can go to the All Souls website and click the big blue button, or click the link in chat. When you get to the giving page, enter the amount that you would like to give. On the next line, be sure to pick Give to Forum so that the money comes to support the forum. After that, you can choose how often you'd like to give. You can leave it at Give This One Time, or you can pick Give This Weekly, every 2 weeks, monthly, or yearly.
I like the idea of making a payment each month. It's just easier to budget.
I agree. That's what I usually do. After that, you can choose if you'd like to give with the debit card, credit card, or ACH bank transfer. The bank transfer will ask you to enter your numbers off of your check, and it will come directly out of your checking account. Once you've chosen that, pick Continue, enter the rest of your information. Feel free to add any comments you'd like. And if you'd like to cover the processing fee, you can click the button there and then click the Give bar.
Well, that seems easy enough. And let me take a moment to just say, hey, thanks to everyone making or planning on making a contribution. Now, Andrea, you keep mentioning that the links are in the chat. How do I see that?
If you're on a computer, it will open to the right of the video of the speaker without blocking anything. If you decide you're done, you can click the X at the top to close it, and that will not move you out of the meeting.
All right. So before we move on to the Q&A, can you please remind everyone how to virtually raise your hand?
Of course. Again, bring your mouse down to the bottom of your screen and look for the reactions button with the smiley face on it. Click it and then click anywhere on the raise hand bar. Zoom will put you in queue so that the moderator can call on you in the order your hand was raised. If you want to lower your hand, just repeat the steps and the bar will now have the lower hand option. If you'd like to see where you are in the queue, you can push the participants button and you will see this view showing you the order that you will be called on.
And for those of you on a phone, you can push *9.
Anything else I can show you guys today, Richard?
No, I think that covers it. It's time for questions.
Okay, Nomachot, we're on here. Before we start with questions, I do want to make one little announcement that our forum next week will feature Lynn Barnett, who will talk on the subject of trans and non-binary rights. That should be an interesting discussion. But now on to questions and answers. Need to do what I was just advised to do and pull up the chat here. I don't see any hands raised. Oh, I do see a hand raised. So Richard, looks like you're first up for a question.
Nomachot, this is a difficult question. How are we going to get the Missouri State Legislature and other state elected officials to start respecting the will of the people with these ballot initiatives? Do we have any plans for that?
Yeah, I think if we're talking about current legislators, I don't think that they will ever respect the will of the voters. I think the only way that that's going to be possible is that if we are demonstrating our power as well as electing folks that actually represent the communities that we are part of, and that who actually respect the communities they represent. Our work moving forward is actually really focusing on transforming the electorate and having more folks be able to vote who typically would not. So we are working in the same coalition that we had talked about that gathered signatures. Now we are working to mobilize folks who historically have been disenfranchised and who typically don't vote. In the next decade, our work is focusing on building up voters to be able to kind of transform in that way. Because I do not think that current legislators would be able to do that. So the only way to do that is if we work in coalitions and collaboratively put pressure, as well as elect folks that actually represent our communities.
Our next question is coming from Carol.
So mine's sort of a two-part question. I'm so glad that it's finally gotten worked through and they're starting to do it. And I did help a little bit with pre-COVID when we were doing that, not much.
Yeah.
Getting the petitions, even if I live on the Kansas side. So I'm wondering about other states, whether you all have any experience with other states with AmeriCorps or others that don't have the petition process and trying to get them on board. When you talk about how many people are affected by this, I know it's even more, I think, in Kansas. So, but it's a little different history. But so do you have any knowledge of AmeriCorps being involved or in non-petition states or any, or have you worked with any in any state where they?
We haven't worked with non-petition states. We had worked with Oklahoma, who had just I think within that, what was it, 2019, who had just also expanded Medicaid. So I actually don't know. We haven't worked with states that don't have the petition process, actually. But we are, one of our funders directly works with us on those specific issues. So Community Catalyst works with several organizations across the United States, specifically around changing the to Medicaid expansion and other healthcare policies. So
What was that organization? Did you say
Community Catalyst?
Catalyst. Okay.
Mhm.
Thank you.
Yeah.
Joe, you're up next.
Yeah, hey, good morning, Nomachot. I'm figuring this must have been a real emotional journey for you and people working with, and you with really big joys and then huge frustrations too. I mean, could you take a little time just to kind of take us inside those moments? I mean, how you felt it, how you dealt with it, what were the hardest times, and how do you get through that?
I think at the beginning, because our goal was so steep, I think for us, we were so focused on, especially with the signature gathering piece was a lot of work. And especially because by the time that we were getting toward the end was also when the United States was taking COVID more seriously. And so the last time we did a larger signature gathering event was during the primaries, which was a very interesting time to do it because at that time they were advising folks to not to social distance. I don't really think we had the mask mandate yet. So it was kind of like a risky time to do it, but also it was the last stretch that we needed to be able to get all the signatures that we needed to turn in by April. So we were basically posted in a lot of districts where people were in line to vote and were able to gather. And by the end of that day, we basically just celebrated in camaraderie in terms of the work we had put in, because it was several months of preparation, and we had debriefed in January together. Organizations had debriefed together and talked about the challenges that we had, or the pros of places that we have gathered. One thing that was great was being able to, when gathering signatures, also collect people's stories, because people who were signing, some of them would have been the folks that would qualify to get health insurance. So to be able to hear their stories was amazing. And so when August 2nd came around and getting out the vote, we basically put, a lot of our volunteers worked very very diligently. And by the end of, I guess I'll say by the end of the campaign and by the beginning of August, people were exhausted to the point where it was harder to get people involved in the November campaign. And then with COVID, I think, it was a very interesting time to kind of figure out, like, especially with everything being virtual, how hard, figure out how to raise morale in that kind of space, basically. So there were large celebrations virtually, like with the fact that Medicaid got expanded. It was a very emotional time for all of us. I was emotional because I had a younger cousin who had Crohn's disease, and he had just turned 19, and his mom doesn't make that much money, and the kind of thing what he had to do regularly, and with the fact that he had just been dropped off Medicaid actually early than he should have, it was something that we were very concerned about. And I could just think about people who know a lot of others who had those same kind of issues. And then that also reminded me about, like, the fact that our get out the vote plan before COVID was going to be more in person. And so we were actually very concerned about the fact that how we're going to be able to reach people and get folks out there in the middle of a pandemic. And how are we going to be able to train people in phone banking and understanding like the Medicaid, the talking points we were using to let folks know about about Medicaid expansion when we would have been doing phone banks in person in the same rooms. And so it was a learning curve actually to turn everything virtually. And a lot of our volunteers are actually folks that are retired. And so there was a lot of work to also, on top of teaching the software needed for phone banking, we also needed to train folks on Zoom and for them to understand how Zoom works before even trying to get to talking about the tools we're using for phone banking and to talk about getting folks out to vote for Medicaid expansion. So that was a very interesting time. It was exciting because we worked with other organizations towards the end of the campaign. So it was nice to see to work with people from like Planned Parenthood and Jobs with Justice all in one like virtual room. And so it was a lot of fun in those ways. So that kind of kept the morale up. It was very exhausting afterwards as well. So.
I also want to hear about the frustrations too. Like, you did all that work and congratulations and get it through the way you described. But also, and then when the things happen with the governor and the legislature, I mean, what were the worst parts for that? The hardest parts? How do you get through that?
I think the hardest parts were trying to understand, because a lot of our volunteers were expecting us to immediately know answers, like what to do. And that wasn't clear, because a lot of things that we anticipated, we didn't expect to happen. We didn't expect legislators to not fund Medicaid, especially because it was something that was popular. One of the things we would tell like a senator or a representative is like, this like Medicaid expansion was popular in your district. And we were able to say like, oh, in this district, 50, 60, 70% of your voters voted on Medicaid. But it was interesting to see that they just dismissed that. And I think it was a lot to try to be able to understand, like, what can we do as an organization to try to, like, what is to do strategically. And so that's why, like, for us, rallies are an effective way for people to at least get their emotions out about their frustrations. So we did that throughout the state strategically. The other thing that was kind of interesting to deal with was the fact that there was like the larger Medicaid expansion campaign, and then there's like the work we are doing with our volunteers. So we connect the volunteers to the Medicaid expansion campaign. So we knew there was a lawsuit happening, but we obviously didn't know like what direction they would go with it. So having the lawsuit and also having it still be legislative session, we basically tried to do as many things as we could, but there was not as much confidence of we didn't know what was going to happen. And to be quite frank, our like the environment in the Capitol at the time was kind of volatile. You really didn't know what decisions legislators were going to make about things. And the other concern was just COVID and their response to that, because I remember that they were heavily focused on things like, you know, making sure that businesses weren't liable for their actions during COVID, and there were so many bills trying to attack a lot of things like protests and things like that. So it was an interesting time and space to be in, and it wasn't. And then on top of it, people were starting to experience Zoom fatigue and trying to somehow balance all of that and not know what it means to be in a pandemic. So yeah, it was not an easy time. I think we mainly just relied on building morale in ways like doing rallies and having events where people were able to just tell their stories and educating folks on other policy issues. So at least they felt informed enough to feel comfortable, but that's all we could at the time.
Nomachot, this is Michael. Let me jump in here. I know we've got another question from Richard, but I wanted to ask a question that's been on my mind. Can you help all of us understand the minds of those, particularly in the legislature, but really across the state, who are opposed to Medicaid expansion? It seems like such a no-brainer to me when the feds are paying 90% of it and there's so much benefit for the people and for the state. I actually heard a speaker, one of the Republican state legislators, talk against Medicaid expansion just the week before last. And his argument was that even with the feds paying 90% of the cost, Medicaid at the expanded level would consume more than a third of the state budget. Is that accurate? And if not, what is the correct proportion of the budget that this new law will actually consume out of the state budget? Do you know the answer to that?
I know part of the answer. So Medicaid and programs like it do take on a significant part of the budget. That is something that is true. The difference is that even if we don't expand Medicaid, that would still be true, but with us getting less money in terms of reimbursements. So it wouldn't make sense to not expand because we are basically denying federal money coming into the state. I actually think the reason that they use these talking points is more for political reasons and has nothing to do with like fiscal sense or anything like that. Because during the campaign, they were even using racist dog whistles, like saying that undocumented people could get Medicaid. And they would have imagery of like, it was crazy to see this, but imagery of like the Mexican flag on a mask and saying these things. In all honesty, you can't get Medicaid unless you are unless you have some kind of form of documentation. But also we tried, even though it was false, we tried to make sure to make it clear that for us, our position is that anyone deserves healthcare. And so it's not our job to try to say that, yeah, it's basically that it's okay that it's that way, but it was also false. And they were doing that to kind of divide us. Another thing that I forgot to mention too was there's this rhetoric about rural versus urban and these issues, and how that the reason that we won is because of places like St. Louis and Kansas City, but we won because of rural voters. There was a lot of areas that were very important, and those places had 50% or higher, and so it wasn't something that was only in urban areas that people voted. Yes, that's important to bring up because that is a strategy that's used a lot, is to divide rural and urban, which in honesty is coded language that's more about race, and to try to use that to divide us and make it seem like we're not on the same page and that these policies don't directly impact all of our communities.
Well, if you had to say, here's the most significant motive for those opposing Medicaid expansion, what is it?
Honestly, I think it depends. If we're talking about legislators, I think it's more about their own collective strategy around those things. It is because we are when we are divided around issues like that, it's easier for them to influence policies in ways that, like, if we had been collectively putting pressure on them, they would have to do things the way we do them. But I think for some everyday voters, it's also because they're getting like false narratives around Medicaid. They think it's going to be too expensive. They don't know anything about the reimbursement or any of those things. They just are basing it off of what they find online. And that's been a huge problem too, like false information because of social media. So
you would say it's money is the primary motive?
Yeah, I would say it definitely is money for sure. What's interesting too is that I was on an NPR interview with I think it was Hegeman, and I thought it was interesting that he was saying things about, like, if we expand Medicaid, how are you supposed to help the kids and education? Like, we won't have money for either thing. Which, if someone's listening and doesn't know anything, they'd be like, oh yeah, that makes sense. But in all honesty, like, they have been continuously cutting funding for education. So like that's not something they actually care about. And on top of it too, they have made, especially specifically Hegeman, for example, had made a decision with the crime bill a couple of years back that ended up costing the state way more money than they actually proposed it was going to. And so there's also this unfair treatment of, like, if there are programs that directly help people, it's almost like they are under the microscope and have to be perfect, and our math has to be right about how much money is gonna come into the state, all these things. But a lot of bills, especially around things like crime, are not as heavily regulated, and they have been ways to cost the state a lot of money. In relation to Medicaid, actually, work requirements for Medicaid cost the state money. It costs way more money to have to try to follow through. When I was at Americorps Vista, which you don't make that much money, I applied for food stamps, and I had to verify, like, my income and give them the information. I did what I was supposed to do and still got denied. And the reason I got denied was because of human error. And then I had to go through this whole process to call them, and they were like, okay, and they had to fix it. But to have to pay additional people to follow up on things, it costs the state more money than to just be able to give people the access to the things they need, especially because, again, there's no reason for work requirements, since most people who need Medicaid work. That's the problem. They all have jobs and cannot afford healthcare.
Okay, thank you. Richard, you've had your hand up.
So you kind of partially answered my question in what you were saying, but if you could elaborate, please. To what extent do you think the resistance among some white voters to Obamacare has to do with anti-Black and Hispanic racism?
Oh, I don't know to what extent. I would say that the fact that it's called Obamacare is the issue that some voters have with that. I've heard people literally say that they don't Obamacare, but when you say Medicaid expansion or anything related to that, then they are okay with it. So it's like the way things are framed is the issue. For example, even things like Clean Missouri is the way that they have they use great marketing to make it seem like these things are actually either good for us or trying to divide folks in those ways. I think it's definitely an influence. It's hard to say. This is what I will say. I think the issue that we have, and because of the history in our country, is that one, anything that has to do with providing public support around healthcare has already been attached to Black and Brown people, and for that reason, like that being the main person in folks' heads, it makes it seem as though the things that they're going is not the same thing as the person that's going through. So like, and I've seen this happen before. It's like, oh, those people don't deserve these things, but like I should be able to get these things because I work hard, and it's because they don't see themselves in those people. And that's not like an every white voter thing, but that is a component of the issue, is attaching entitlement programs to racial identities, and so that being the stereotype, people are basically like, that we're not the same, and that's really what the issue is, and which of course we know, like in Missouri, the population of people of color is very small, and so actually most people who are going to benefit are going to be white, but nobody talks about it in that way.
Joe, you've got another question.
If I could, yeah, Nomachot, I'd be, if you don't mind, I'd be very curious about a little bit more about your story. I mean, like, what motivates you? Why are you putting all this effort in? Tell us a little bit about that.
It's a good question. So like I said, my family came from South Sudan. I grew up in the United States, and it was an interesting time to deal with. Like my main experience with dealing with the public was going to elementary school, and so like the experience I had in my house and the experience I had outside was very different. And so going through the school system and hearing, other students and how they talked about the things that they were going through, the issues they had. Like I didn't think about things like, I never thought about like getting involved in the community in that way when I was younger. But when I started to realize how things were connected and how these certain policy decisions is why XYZ happened. Like, for example, I spoke earlier on maternal mortality. One of my siblings was, I'm the only one that was born outside of the country. So my sister right after me was actually supposed to be a twin. And I went to a symposium that where a Black woman who was a professional, made good money, talked about how, her life was at risk when she was pregnant and had twins. And so to learn that this is because of systemic issues, and that, same things that woman was dealing with, same things that my mother dealt with, for example. So my mom only ended up instead of having twins, she only gave birth to my sister, and my younger brother did not survive. And so it's when you find out that, these decisions and these systemic issues directly impact your life in those ways, and you didn't know, that's like the reason that I get involved in these things, is so people can see how those things are connected. I learned so much about race and from going to school in terms of, but just as being a Black woman, and then also being from a country that people only associate with a lot of conflict. It directly impacts how people see me, how people treat me, and it's something that for me, important to talk about because, you know, I don't have a shame of being from these places because I didn't play a role in why they are this way. These issues are things that have been passed down and something that we have to discuss so we know the context of it and so we can change it. So like there's this narrative that, you know, still if you work hard, you know, and you do XYZ, then you're going to have a successful life and things like that. And that is something that is specifically plaguing Missouri because it makes it seem like folks are in the situation they're in because they didn't work hard enough. And when we don't acknowledge like the systemic issues, then people, they blame themselves and we continue to have these issues, especially when there's such large scale issues. Like we are all impacted by these things, but when we listen to these narratives, it causes us to not actually address what the issue is. And yeah, for me, I think when I start to realize that speaking on my experience actually did change people's minds, that's when I realized like that this work is very important. So like organizing and changing policy is about using your voice to tell folks, you know, when you make this decision, this is what it does to my life. And it's harder for legislators to make those decisions if they actually can attach it to someone that they're speaking with face to face. So we know it works. The only difference is that legislators also organize and they have money power, and we have to leverage people power to do the same thing they've been doing. But things like race is kind of the issue that divide us and that don't have to divide us. And so luckily the work that we do, we focus on not only addressing community issues, but doing it in a lens that focuses on dismantling white supremacy, because that is a tool that is used to divide us. And then the other issue is that they're I don't remember where I heard this from, but it was like the reason that we have these issues in America. I remember someone saying it's something to do with people thinking they're temporarily embarrassed millionaires. Like they think they're going to be able to make this this kind of money, or they think like, you know, if they're doing better than a lot of people in their community, then like they're who we talk about when we say wealthy white people, and it's not. We're talking about people who have so much money they can influence an election. And so if we see each other as equals, then we can do the work collectively. But if we feel like, oh, you know, I'm not going through that same thing, or like, oh, I don't have that issue, so I'm not going to be involved. Like we all have to have the self-interest to collectively change the environment. And I think we miss out on so much because if we didn't have things like white supremacy dividing us, then we would have a lot to look forward to in the state of Missouri. And unfortunately, it's something that's hard to see when it kind of relies on folks having an imagination and seeing beyond the realities of what's going on. And the only way we do that is just collectively and through relationships.
We've got another question from Renee.
Hi, so after the success and then the heartbreak of the legislators not funding the successful vote, now October 1st comes. Is the campaign for Medicaid for all complete? Have you succeeded in your goal and now it's done? Or are you just sort of waiting to see if that other shoe drops next week? Or what is the future of this now? Now that we're here, October 1st?
For one, there's a lot of Missourians that actually don't even know about the whole campaign. So part of our job is going to be to educate folks on the fact that they do qualify and they'll be able to get access to healthcare. But also, the expectation is that we're always going to continually have to defend Medicaid and protect it at least until the electorate changes. And so, like, part of our work at Missouri Healthcare for All now is to focus on destigmatizing the whole idea of universal healthcare so people see the benefits of it. And through that work, that for them to be able to be like, ask their legislators, are those things that you're focusing on? Because again, people think that it's costing the government too much money to have Medicaid. And so they have this false ideas of these programs, and they don't see where they fit in. And so a lot of our work now is really going to be very heavily focused on relationship building and having conversations around universal healthcare and the pillars that we had talked about, while also trying to transform the electorate and have more participating in elections and voting. And that is like long-term strategic work and something that we are doing in partner organizations. So it's not as siloed as it historically has been. And so for that, which it kind of helps us too. So, we focus on healthcare, but another organization focuses on labor rights. We still work on the same issues because a lot of times they overlap. And so that it makes it more effective in those ways.
Let me ask the last question here, and that has to do with the collecting of stories, Nomachot, that you mentioned earlier. As you collected these stories, was there one in particular that you want to relate to us that particularly moved you and that you found yourself repeating?
That's a good question. I will speak on my friend. I have a friend who she's a writer and a poet, and she identifies as an Indigenous Chicana. And I was honored to be able to collect her story in relation to Medicaid because she also is a veteran. And knowing her personally and seeing how difficult it was for her to access healthcare as a veteran, and it's something that I was very important for us to speak on. And one of the questions that we always ask, like our storytellers, like, what does healthcare access mean to you? And she said it meant freedom, and it meant that she could do things and know that she'd have a foundation of what to come back to, and be able to go access healthcare in places no matter where she was, because she lives in Kansas City, and she had to go through the VA to get a lot of her care. And the problem with that as veterans in Missouri is that is something like you have to go through just them for a lot of the access for things, and it causes an issue with being able to get things if you're from a different place or things like that. But I think for me, her story is really important because a lot of people say that they have respect and honor for veterans, but what I found through this work is that a lot of veterans actually don't have the resources they're supposed to get. And so, do we really have respect? Are we really honoring them? And yeah, so and that's actually one of the significant populations that are going to have access to Medicaid this year. So yeah.
Well, Nomachot, thank you very much for presenting. Really appreciate your interesting talk. So thank you again.
Yeah, thank you guys so much. And thank you for the great questions.
Well, we'll wrap this up. And again, next week, we're going to hear a talk on trans and non-binary rights. And we'll look forward to seeing you. And with that, we'll conclude the forum. Have a good morning.
Bye, guys.